In addition to this curiosity, I also like to bring in playfulness whenever I can as another diffusion technique. So, for example, if I'm asking her to be curious about the pressure or weight she feels on her chest, I might ask her, does it feel like a tiny kitten that's sitting on your chest? Does it feel like a giant, huge, like Garfield cartoon cat that's sitting on your chest? And that usually takes her aback a little bit, interrupts the process, and forces her to actually pause and consider what her experience is. A lot of times we become so focused on the content of what we're experiencing on these kind of labels, right? Panic, anxiety, this is bad, that we don't actually pause and understand what it is we're actually feeling. It's one of the reasons why, in response to shortness of breath, people end up hyperventilating because they feel like they can't breathe. So they start sucking in a lot more air, increases their CO2 levels, leads to hyperventilation, potentially lightheadedness and fainting. But if I can help her slow down and go, okay, you feel like you can't breathe. Your mind is telling you that you can't breathe, right? We're creating that space and separation there. Your mind is telling you this, or you're having the thought that you can't breathe, and you're able to talk. You've been having this sensation for how many minutes? 4 minutes? Okay, well, do we think that if it's been 4 minutes and you actually couldn't breathe, would you still be conscious? I know I can't hold my breath for 4 minutes. And so by helping her be curious about her experience, describe it. So let's say she's feeling flushed and kind of hot and sweaty throughout her whole body. I might ask her to imagine, and she could keep her eyes open or closed, imagine almost like a heat map, one of those kind of like nighttime vision goggles. I don't really know how they work, but they sound a lot of fun. But helping her create that heat map. So noticing, okay, what are the areas in your body that feel really hot or really flushed? Let's make those dark red. And what about your fingertips? Are your fingertips warm? And she might look down and go like, no, I actually don't even feel my fingertips. Okay, so maybe we can make those blue. And what it's doing is it's allowing her to come in contact with a sensation that feels scary, but to do it in a way that she's not overwhelmed or consumed by it, that she can actually take a step back and look at the experience that she's having. And by doing so, it creates some curiosity, some inquisitiveness, and it also helps her shift her attention away from the part that's causing a lot of distress to maybe her fingertips that aren't really feeling any weird or different at all. In addition to leaning into playfulness, one of the things that I like to do is to give her mind an avatar. So in ACT, one of the common diffusion exercises is to name your mind. So give your mind a name, and then let's say Sarah's mind's name is Francine. And when she's feeling really scared about doing something or feeling really anxious, I might ask her, what is Francine saying? Oh, she's telling me that this is a terrible idea and I'm going to have a panic attack and it's going to be horrible. What it does is it allows us to get some space between our experience and what our mind is doing so that we can look at it from a place of distance. This is also one of the reasons why journaling can be really useful, because it's taking the information out of your head where it gets all jumbled up and confused and putting it down on paper so that you can actually pause, look at it, read it, and actually be able to think and process through your experience. So by creating some separation between Sarah and her mind, Francine, what ends up happening is that she's able to look at those patterns and see them a little bit more clearly and realize, okay, Francine is trying to help me. She's trying to keep me safe from this imagined threat, but I don't need her to protect me in this moment. I might even have Sarah come up with a couple of things that she says back to Francine, not with the intention of getting rid of her, because again, our goal isn't to completely eliminate anxiety from our life, because that's not a workable goal, but instead to help her learn to say, hey, Francine, I see you, and this is not helpful, so you're not going to be my focus. My values are going to be my focus instead. And help her create that ability to pivot away from listening to what her mind's saying and what the sensations in her body are saying towards something that's a little bit more of a values-based behavior. Now, sometimes I take this exercise a step further and I have them actually create an entire animal. And animals are inherently innocent. And as a result, even if you pick a really scary animal or something that you're afraid of, let's say a tiny spider, and we give him a name, it could be a human name or a pet name. Let's say we call him Sprinkles, Sprinkles the spider. If we can picture that animal, right? If Sarah can picture like Sprinkles skittering around, whispering in her ear that something's dangerous, that she needs to leave, kind of anthropomorphizing, giving the animal human characteristics. It allows her to express herself, but in a way that's not overwhelming and consuming. It also gives us a common narrative, a common metaphor to use to talk about some pretty big experiences in a way that seems playful. So instead, let's say down the road when she's doing exposure work, instead of asking her, like, what was it like when you felt like you couldn't breathe or you started getting dizzy? I might ask her, what did Sprinkles do in that moment? What did Sprinkles say to you? And it gives her the space to pause and think and be in her experience instead of be consumed by her experience. I also might walk Sarah through some present moment awareness or mindfulness exercises, some very brief grounding exercises, such as coming in contact with her five senses. I like using tapping, for example, of just being able to touch your fingertips together and noticing when that moment when they touch, if you can kind of feel that tiny sensation. Because generally, when we experience panic symptoms, like the physical sensations, they really usually show up between like your neck and your navel, kind of in that core trunk of your body. And while sometimes your legs might feel shaky or your hands might feel sweaty, usually your hands and feet aren't the primary panic sensation. So if we can help a client turn their attention to a more mild sensation that's still within their control, not as a way to distract or avoid what they're experiencing in terms of panic, but just bringing in other experiences that help them see, okay, part of my body and mind is telling me that this is a threat, but the other part of me is just kind of neutral, and is a little bit more subtle. And if I can focus on all of that, I might be able to have a more realistic experience of what's happening in this moment. So I might walk through some different strategies, and you might have some strategies that you use already with clients that are super effective. And you might mix these up based on what works best for a client. So Sarah did really like the guided mindfulness exercises, but I do have some clients at times who don't like eyes closed exercises. Maybe it's hard for them to focus. And so I might assign them a exercise like touching their fingers or just taking 3 breaths and noticing that. And that might help them be able to practice the skills without feeling frustrated or feeling like they're failing.